You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. I'm your host, Dr. Emron. Today we'll talk about the case of a young boy I met about 2 weeks ago. We'll call him Michael. Michael was about 5 years old. He was brought in by his mother on a Tuesday morning. She said that her son told her he was at school on Monday morning and had put a nickel in his mouth. His friend had dared him to do it, so he put it in his mouth. Then, as he was laughing, he stated that the nickel went down his throat and into his stomach. He didn't tell anybody at school, and his friend didn't tell anybody at school, but he told his mom overnight because his stomach started to hurt. The mother was unable to get into her pediatrician, so she brought him into the emergency department. When I examined the boy, he looked perfectly fine. He wasn't vomiting, he had no signs of coughing, he wasn't looking very ill. And I asked him where he thought the coin was, and he showed me with his finger. He pointed to his left upper chest area and said, "I feel it right here. I think that's where it went." Now, the mother wasn't quite convinced that he actually put a nickel in his mouth. She thought that he was trying to get out of school. She thought that he was just playing a trick on them and really didn't want to go to school that day. I said, well, why don't we do an x-ray, and that will easily confirm or rule out whatever the situation may be. She agreed. He went to x-ray, and as soon as he came back, I looked at the pictures, and I realized he was actually telling the truth. On the x-ray, it was very clear that there was a nickel in the stomach. Now, the mother was very nervous. She had never experienced this before with her other children, and she wasn't sure, did he need surgery? Did he need medication? Did he need to be hospitalized? And that's what we're going to talk about today. What happens when a child or an adult swallows a coin? Now, in this situation, we have to back up a step. So whenever we talk about swallowing foreign objects that are not food related, we have to identify what they're made of and what the problems could be. So in this situation, it was a metallic object, which is a coin. Coins, as you know, come in many different sizes. Pennies versus dimes versus nickels versus quarters. For some reason, young children really like to put things in their mouth, especially things they find on the ground, or if somebody dares them, if they're older children, to do something that sounds very silly and harmless, can actually cause some major problems. The tricky part with a coin is that once it goes in the mouth, naturally there's a slight reflex where the person may actually swallow it, even before they have a chance to spit it out. And that's because of the shape of the coin. It's fairly small, it's rounded, and it goes down the throat fairly quickly. The complications that we see with coins can be very serious. For example, if the coin lodges in the trachea or the airway, that is life-threatening. And there are many children every year who die because they've swallowed an object, usually a coin or a button or something of a similar size, and it lodges in the airway. Those children begin to turn blue in the face, they pass out, and oftentimes they don't even make it to the emergency department. What happens is those kids die because they have a lack of blood flow to the brain, and there's no way to recover from that. Now, the other situation is where the coin doesn't end up in the airway, but it goes into the esophagus, which is the swallowing tube. Once it gets to the esophagus, there are parts that are narrow and there are parts that are more wide. So in this situation, a nickel is a fairly large object. However, the esophagus is able to stretch just enough for it to slide down. If the nickel had become caught in one of the narrow parts of the esophagus, the child will begin drooling. They'll have trouble speaking. They may try to throw up, and they'll have some severe pain. Usually it's pretty obvious when that happens, especially if there's an adult or an older child around, that they'll try to bring in that child for help. However, in this situation, the coin quickly went down the esophagus and into the stomach. So he didn't have pain right away, and he probably didn't want to tell anybody what he actually did, but he had pain later on, which is why his mother brought him in. Now, there are other foreign objects that people commonly swallow for different reasons. These can include metal, things like paper clips. They can include rubber, for example, the tip of a pencil eraser. It can include things like jewelry. It can also include things like drugs or things that people find around the house. Now, with young children, especially if there's siblings involved, oftentimes the older sibling will pretend, and try to feed a younger sibling. Oftentimes there's small toys, like little wheels or little plastic food particles, things that normally wouldn't be consumable, but they're made of plastic and they look like regular food, and so the child may swallow that down. More serious things are going to be sharp objects, things like needles and pins even branches. Some people may swallow glass. Other people may swallow bottle caps. The list is endless. There's just a large number of things that people want to put in their mouth for different reasons, and unfortunately, those can cause some major health issues. Now, going back to what we talked about with this coin and this boy, Michael, the esophagus is the narrowest part of the digestive system in the upper portion. There are valves that have to open and close, which allow the swallowing and also allow food to stay in the stomach instead of going back up towards the mouth or the esophagus. In this case, the coin rapidly went down into the stomach. The stomach is a fairly large organ. It has a lot of space. And once the coin makes it there, there's not going to be a major issue. After the stomach, however, it has to go to the intestine. So the small intestine is the next stop on the way, and that's usually where people have cramping and they feel uncomfortable. And the coin will actually move all the way down the intestine, which is about 10 or 12 feet, and then down to the large intestine before it goes out of the body in the stool. Now, I always tell people if they've swallowed a coin, let's say it's a nickel or a quarter, it's very shiny when it goes in. It's not going to look like that when it comes out. Oftentimes, it's going to be black or brown. It's going to be melted because of all the acid in the stomach and the intestine. It's changed the shape of it. It looks more like clay. And sometimes it can break apart. So there could be pieces of the coin or pieces of the button or the plastic that have broken down through the digestive process. Because it's a solid, it will cause a lot of pain as well, especially in the rectal area. There may be some bleeding. People may feel constipated. And some of the complications include infection. There's an obstruction that may occur, which is where the blockage will develop in the intestine, and that's a surgical emergency. Those people have to be in the ER, and then to the hospital, and then to the operating room, and the surgeon would have to go in, potentially cut out a portion of the intestine, especially if it dies, or if it has a severe infection where there's pus or blood that's mixed in there. Now, in this particular case with Michael, after the x-ray, since we knew the coin was already in the stomach, I advised the mother just to keep an eye on him for a couple of days, let him eat his favorite foods, just watch, monitor for any fever, monitor for any bleeding, and I called the family a couple of days later, and successfully he passed it on his own. He didn't need any medication, he didn't need any special treatment. He did follow up with his pediatrician to do a repeat x-ray, and definitely it was gone. There was no metal in the abdomen, there was no signs of any issues, and Michael was very, very lucky. I'm sure Michael is not going to do this again. However, I will guarantee that there are many, many children who will continue to do this on a daily basis, and there are even some adults who may find themselves caught in this particular situation. Now, the testing that we did in this case was an x-ray, because x-rays will show us metal very, very easily. However, other objects may or may not show up as well. Things like plastic or glass or wood may not be as visible. So in those cases, if there's a problem, if there's a complication, we have to admit them to the hospital. They have to undergo some type of surgical procedure or follow-up in order to prevent permanent damage. So I hope you learned a little bit about coins and swallowed foreign objects in children and adults. If a situation like this happens and the person cannot breathe, or there's obviously something wrong with the airway, call 911 because those people may not make it to the hospital in time. They can actually die. However, if we're confident that the object is in the stomach and there's just some mild discomfort going on, you can call your family doctor, go to an urgent care, or come to the ER. Let them do any testing, diagnose what's going on. Hopefully it'll resolve on its own, but now you know some of the warning signs as well. If you have any experience with this, or if a family member or friend had a similar story, please reach out to us on social media. Tell us about that and what happened or what your doctor recommended, and I'll be sure to share it with our followers online as well. Thank you so much for being a guest on today's episode.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.